Oh, Lily, what are we going to do with you? Hey, what are we going to do with you?
Scott's first two patients are in Teddington. Sisters Pickle and Lily are waiting with their owner Sally.
For the last year or so, they have been a bit incontinent. Well, for most of their lives, we've noticed little bits of dribbling, but it has started to get worse to the extent now that quite often they're lying there and you just literally see urine dribbling out of them and they've absolutely no idea that that's happened. So, yeah, it's starting to get quite annoying now, not to mention very wet and smelly.
Sally and her daughter Katrina love their two girls.
Who's my pickle? Pickle, mate. Yeah, look at me.
But the constant leaking is out of control and they're desperate to get it fixed.
Poor little pickle.
And now she's weed on me.
Oh,
looks like I've wet myself.
it's just a normal day in the household, eh? I'd really like to have two dogs that don't leak all over the floor. I'd like to be able to walk into my house, sit down on the sofa and not shoot straight back up again with a wet bottom. So definitely hopeful that Scott will get to the bottom of all of this.
Hello, Sal. How are you, mate?
Good, how are you?
I'm really good. I'm looking forward to seeing these girls.
Well, please come and meet them.
What is that smell, Sal?
Oh, sorry.
There's a serious pong, isn't there, in here? There's a serious smell. Oh, and actually, look.
Oh, lovely.
I wonder what the smell was, and there's the answer. Who's the culprit for that?
Which one?
Hey, who's looking sheepish? Walking into Sally's house, straight away I'm hit with a wall of smell. It's not a good smell. This isn't potpourri. This is the smell of wee. Not a very good start.
Yeah.
So do they both wee around the
They
house?
do. At the moment, Lily's probably slightly worse. You can actually see it flowing out of her sometimes.
And how often are we talking?
Once or twice a day?
Once or twice a day?
Yeah.
Your dogs are peeing in the house?
Well, they're not peeing, they're dribbling.
Oh, Sal. The obvious problem in Sally's house is that she is wading through puddles of wee. Lily has urinated on the floor and she doesn't know that she's done it, and that's clearly a worry. Can I have a little feel of you? All right. Sal, is there ever any blood in the urine at all?
Not that I've noticed.
Okay, so it just looks like normal old wee.
Yeah.
Okay.
Yeah.
Just inappropriately positioned.
Yes. Usually on my lap.
Seriously, they wee on your lap?
Yeah.
Oh, that's
But they
grim.
don't wee, they dribble.
I love the way that you're making excuses for them, which is lovely.
I know.
But your version of normal is not normal.
No.
Having an examination of the two dogs, I can see they're very healthy and they're clearly much loved. But there is a problem here. I'm not sure what it is. It could be a congenitally inherited condition that they've had since they were puppies. It could be infection. It could be hormonal urinary incontinence. There's a lot of question marks here. So what I need to do is to take both dogs into the practice where I'll understand exactly what's going on. Come on, let's say bye to Mummy.
Bye-bye.
See ya. Bye.
Bye-bye. Bye-bye, girls.
Off to the practice with you. Come on. Yes. Try and cross your legs for the journeys, would you, girls? Yeah. Thank you. These girls are weeing all over Sally's house. So Jess, if you want to take her through to X-ray.
Back at the practice, Scott is going to X-ray both of Sally's dogs, starting with Lily. But first, a special dye is being injected, which will outline the urinary tract and show up any abnormalities.
Right, X-ray. We'll take a series of X-rays. It will look a little bit like a roadmap of the urinary tract and see if there's any reason why these girls are incontinent. It's weird. Very strange indeed. I'm doubting myself now because I'm just doubting what I'm seeing on X-ray. The X-ray looks like there's one kidney, which is pretty strange. And it also doesn't really explain why the dog's incontinent. Establishing that Lily doesn't have a left kidney, I don't exactly know what to think of it, and it's certainly not something that I was expecting. I then moved to do an ultrasound on Pickle because I just want to make sure that she does definitely have both kidneys. Okay, so there's one. Yeah, and there's the second one. Thankfully, she does, but I still feel that as these sisters are genetically related and the problem with Lily is likely to be a congenital abnormality from birth, They can both share similar issues. Good girls, that's it. Come on, come on. Where's Mummy?
No, baby.
Hello,
Owner Sally
Mummy.
has arrived, hopeful that Scott has found the reason for her leaky dogs.
I need to sit down after
Oh,
that.
dear.
So I have done a excretory urography. It's basically a contrast image of the urinary system.
Yeah.
And it seems like Lily doesn't have a left kidney.
What?
Yep. I then just ultrasounded Pickle
Yeah.
to make sure that I wasn't going mad, and I could see that there is actually 2 kidneys in her abdomen.
Right.
But this is clearly some sort of congenital abnormality, so from birth.
Okay.
So we need to send you up to the Royal Veterinary College, where the specialist there will do a CT scan, and they'll give a lovely 3D image of everything that we need to check out and see what's what and what's not. And also do a cystoscopy, which is basically where they put a camera into the bladder and they have a look around, not only to see where the ureters come from the kidneys into the bladder and where they drain.
Yeah. Okay.
All right then, Sal.
Okay. Well, thank you very much.
So now I'm going to be sending Sally and the girls up to the Royal Veterinary College, where the specialist will be performing some more tests and then hopefully try and fix them. Bye, mate.
Bye, Scotty.
Bye.
Mwah. If he wants them to go up there, they'll go up there. Trust him implicitly. But, yeah, I'm worried. Go on, let's go.
Scott's now taking a break from his London practices and heading west to Wales to polish up his skills as a farm vet.
I'm really excited to be heading out to West Wales again. The people that live out here are absolutely awesome. They're so down to earth and they're really dedicated to the animals that they look after. So I'm honoured actually that they've asked me to come out and help.
Scott's first stop will be the historic town of St Clair's.
Now last time I was here, I really had to earn my stripes as a farm vet, doing things that I haven't done since my uni days.
He's got a lovely temperament.
Yeah, I can tell. Oh man.
We'll make a farm vet of you yet, Scott. Welcome to Wales.
This time I'm going to have to step up another level because it's all hands on deck. The vets are so busy this time of year, so I just hope that I can keep up with the pace.
Scott will be based at the Market Hall practice, which looks after local pets as well as animals at surrounding farms, and he's checking in with head vet David Stark.
Morning, David.
Good morning.
How are you? Good to see
Yeah,
you again.
great.
So what have we got planned? Lots of carvings, lots of sheep, lots of cattle, hopefully lots of horses.
Yeah, those lined up for the week, Scott.
All right, well, I've got some overalls in the car, I promise. So
Oh, great,
Should I
good.
go and chuck them on?
Yes.
Awesome. Great one. Nice one, Dave. Good to see
Okay,
you.
Scott. Cheers.
Scott's being put straight to work after a call about an emergency at a local dairy farm.
A Jersey cattle owner has called to say that one of her girls is very sick. All we know is that this poor girl isn't eating and she does have a calf.
Scott will be working under the guidance of vet Vicky.
Right, time to get suited up.
Yep.
She deals with big farm animals on a daily basis.
What we need?
But Scott hasn't done any major procedures on a cow since his university days.
Oh my goodness. Here we go.
Waiting anxiously is dairy farmer Helen. She's worried about her much-loved cow Athena, who's recently become a new mum.
She just looks generally miserable and not happy with life. We never have problems with calvings, the Jerseys. So I'm a little bit nervous.
Hi, I'm Scott. How are
Hi,
you?
I'm Helen. How are
Hi,
you?
Helen. And who's this gorgeous beast?
This is Athena.
Athena. Very beautiful. Right, so what are the issues that you've been having with your cow?
She's been calved just under a week, and we've noticed the last few days that she hasn't really been eating as much as I'd like her to. She just looked a little bit depressed.
Right. First thing, let's have a little listen to her heart. That's all clear. So I'll just listen to her stomach. Oh, do you want to have a listen?
there's not a huge amount of noise going on in there.
It's quite quiet.
Yeah.
The rumen's not moving.
Yeah. So it's just not functioning at the moment. Yeah. All I can hear is complete silence, and that's a real concern. The 4 stomachs inside a cow should make a lot of noise, and when they don't, that's a worry. I believe that this cow might be suffering with a condition known as left displacement of the abomasum, or LDA. It's basically where one of the 4 stomachs is twisted and can commonly happen after a cow has had a calf. The way that LDA is diagnosed is by using percussion, so basically tapping on the side of the abdomen of the cow.
You hear it?
Oh, wow, yeah,
There.
Oh, yeah. Wow, that's amazing. That is a lot different to the surrounding area. It's very distinctive sound, isn't it?
Yep.
We can hear a very tinny sound, which basically sounds like a bag, which is the abomasum, filled with gas. So it sounds a little bit like a drum. So pretty much part of the stomach that's here needs to go over there.
Yep.
And the only way to do that is by reaching in,
Pulling it back.
pulling it out. Athena at the moment's uncomfortable and she isn't eating and she will lose weight quickly, so we need to intervene with this surgery.
First, I just need to give it a little local.
In Wales, Scott and farm vet Vicky are about to begin critical surgery on new mum Athena.
You're not going to like this, yeah? You're going to jump a bit.
She's being given a numbing injection in her side, but she'll be awake throughout the procedure.
Good girl. I know. If a large animal is calm enough and quiet enough with just a light sedation and local anaesthetic at the site of the incision, it's far better for them and it's far safer as well. Some nice happy drugs for you, sweetie.
After carving, the much-loved Jersey cow has been left with a badly twisted stomach.
One of her stomachs is full of gas and has moved to the wrong place. So we need to get that back in the right place. But sometimes you can open them up and they've been twisted for a long time and the abdomen has started to react. So until you open them up, you don't really know what you're going to find.
First, Scott and Vicky need to release the trapped gas before moving the stomach back into place.
Good to go?
Yep.
The procedure will be performed through an incision made in Athena's side.
So I'm always nervous when surgery's involved in any animal. We haven't had a huge amount of them done here either, so from an owner's point of view, it's a little bit nervous to watch it happen, yeah.
I can just feel across. I can feel a nice big stomach on the other side.
Right.
So now we're going to deflate the stomach.
So this is quite a dangerous moment, really, isn't it, Vicky?
Yeah, this is quite a big needle, and idea is we want to just take the needle across, put it straight into the abomasum and get the air out.
Back in my uni days, we learnt about farm animal stuff, but it's about 20 years ago, so I do need to refresh my skills with these fantastic farm animal vets.
So if you're going to stab anything, stab yourself.
Right.
So you want to take that,
Yeah. So
guard it.
I just want to keep that on there and guard it with my life.
Yeah.
All right, Athena, you can trust me, sweetie.
So round the intestines.
Oh my goodness, that is actually quite hard to do.
Yeah.
Without stabbing yourself.
Yeah. So once we open up the cow, you're going in blind. It's just experience and knowing what's normal and navigating under and round quite important bits of anatomy.
And then
Just straight in.
straight in.
As far as you can.
Okay,
And then
it's going in now.
there we are. So the gas that comes out, that's basically fermented grass. That's what they're eating at the moment. And it's sat there for a good couple of days, so it's quite rancid kind of smell, really.
My heart is actually going, doing that. So that's frightening, is performing a procedure like that, a massively sharp needle around this poor girl's organs.
Protect the needle, bring it back out.
Okay, yep. Okay, please don't move. Okay, good girl. There we go. There we go, there we go, there we go.
Brilliant.
Oh, man.
Fingers intact?
Fingers intact, cows intact.
With the gas removed, the stomach now has to be manipulated back into its correct position.
So what Vic and I have been able to do is to retrieve the abomasum, which was over on the left-hand side where it shouldn't be, pulled it underneath and then up, and now Vicky's busily lassoing it to this right-hand side of the cow. And what that does is means a little bit of scar tissue will form. It'll stick the stomach where it should be on the right-hand side, and hopefully it'll never flip where it shouldn't go again.
So pull that tight. It's nicely
attached to that
attached there.
wall.
So you just need to stitch the skin.
The suturing of a cow is actually really quite difficult because what we're suturing is leather. So it's very thick and very tough to get through. But at the same time, you want to get a nice, pretty result so that the farmer's happy, just like our owners back at Richmond. All right, last one, sweetheart, last one. That's it.
Yeah, all zipped up.
Very nice. Lovely.
Right.
An antibiotic spray completes Athena's treatment.
Great, good job.
Athena is immediately looking so much brighter. She just looks like a different cow already. I was really happy with how Scott and Vicky worked together to get it done. So it went really well. It couldn't have gone any better.
Before Scott leaves, he wants to see how Athena's 6-day-old calf is coping without his mum.
This is Athena's son Achilles.
Hello, mate. Oh, hello, beautiful. Whilst Mummy was getting surgery, you didn't get your breakfast, did you? Hey, no, you didn't. Here we go. You gonna have some? There you go. There's the good stuff right there. Oh, yummy. Good boy. It's been a really incredible day today to be able to work alongside Vicky and to help Athena and now to feed this adorable little youngster. It's been a great end to an absolutely perfect day, and now I can see the benefits of being a farm vet. Pretty nice, really. Well, they seem to enjoy that, and hopefully Athena will be able to do the job moving forward.
Yeah, she's already looking a lot brighter, so hopefully he'll be back in with her tomorrow morning, hopefully, to just have a little bit of a suck, and then she can go out with the rest of the cows then.
Yeah, unless you want to come home with me, eh? Eh? Yeah.
Come on, good girls. Let's go find out what today's got to bring, shall we?
Back in town, Sally has arrived at the Royal Veterinary College with her 2 bulldogs, Lily and Pickle.
Come on, Lou. Good girls.
Hi there, Sally.
Hi, yes.
Hi, Stein.
Hi, Stein.
One
Nice
of
to
the
meet
internal
you.
medicine specialists with my team.
Hi, team.
And these are Pickle and Lily.
That's
Did I get it
correct.
right?
Yeah,
yes,
you did.
very
Well
good. And they are weeing in inappropriate places,
They
right?
are weeing everywhere.
Very good.
Yeah.
So
Yes,
up to us
not
to
very
figure
nice.
out why that might be happening and see
Please.
whether or not we can do something about that.
Pretty please.
Very good. Shall we get a room?
Yeah, that's
Thank you.
nice.
Follow us. Come,
Yes.
Pickle, Lily. Here we go.
Come on, girls. Pickle and Lily are incontinent. We thought it was just a little bit of dribbling here and there, but it's getting worse as they're getting older. They're now starting to lie there and, yeah, it's not very pleasant, basically. Nice damp floors, nice damp sofas, house smelling of pee. It's, yeah, getting a little bit unpleasant.
Hello, you.
Internal medicine specialist Dr. Stein Neeson will be in charge of the investigation.
And we can see the problem in action here, with already a puddle being created. So I see many of these cases on a yearly basis, but Lily poses a real dramatic case with the urine dribbling in front of my eyes on the examination table. I can't imagine how difficult it is to have Lily in your own home. So we definitely need to try and fix this. Right, we need to figure out what the detailed anatomy is of both Pickle's and Lily's urinary tract, because something is preventing both of them to keep the urine in the bladder. So I would suggest that we use a CT scanner to really get down and dirty with the anatomy of both Lily and Pickle's.
What started off with just being a few dribbles is now turning into puddles, and I think before long we'll be turning into lakes.
Lily is first in the CT machine. When Scott x-rayed Lily, he discovered she had only 1 kidney.
So the fact that Lily has only got 1 kidney is slightly odd, but that sort of gives me a hint that I should be open-minded as a vet to look for other abnormalities that Lily was born with. The one point that I'm looking at here is this white dot, which is the tubing that normally goes from the kidney to the bladder. What happens here with Lily is that this tubing is actually ending up very, very late into the urinary tract in the bit that we call the urethra, which is not in the bladder anymore. So that explains perfectly well why Lily is incontinent, because if your urine goes not into your bladder, but into your urethra, there's no mechanism to stop it from coming out.
Now it's Pickle's turn to be scanned. Unlike her sister Lily, Pickle was born with both kidneys.
So we've just done Pickle's CT scan and we've got a double whammy. Pickle does have 2 kidneys and both kidneys are ending up putting the urine in the wrong place, way too far back. So Pickle has got the same problem as her sister.
It's time to break the news to owner Sally.
So they both have an ectopic ureter, which basically means that we've got a bad connection between kidney and bladder. And we are going to try to create a good connection once again. And the strategy we will be looking forward to trying to use is a laser technique.
Okay. So basically you're talking about rewiring my dogs?
Yeah, well, replumbing actually.
Fair enough. This is absolutely brilliant news because it's something we can actually do something about. Yeah, what I really didn't want was to be told that this was behavioural and then it's something that's out of my hands, but this is something that we can actually work on.
Surgery on both the dogs will be scheduled for tomorrow.
Not quite home and dry, but certainly, hopefully, a lot drier than we were before.
In Wales, Scott's next job is with vet David at a local sheep and cattle farm.
Okay.
Yeah.
Yeah. Hello.
All right.
Hi, I'm Scott. How you doing?
Good. Scott, this is Hugh.
Hey, Hugh. How are you?
Good, thanks.
So I'm guessing cattle, yeah?
No, we're down here.
What's down here?
Oh, let's go have a look, Scott. Here they are.
Okay. Sheep.
Yep.
Seeing that my patients are sheep, it does make me quite nervous. We don't have many sheep running around the fields of Richmond.
Yes, we've got 2 rams here.
Okay.
And Hugh has asked us to come along to turn them into teaser rams for him.
That means that we need to give them a rather indelicate cut, don't we?
Yep.
Yeah.
A teaser ram is basically produced when they get a vasectomy. That means that they can no longer make babies. So basically, they encourage all the ewes to cycle at the same time so that when the real ram comes in, all the females are receptive and then the lambs are born around about the same time of the year.
Scott, while you catch them, I'll go get my gear ready. These rams are quite tough and they're quite agile. And Scott has got his work cut out.
Good luck.
Good luck.
I can relate, boys. My wife's trying to convince me to do exactly the same thing we're about to do on them. Ouch.
Okay. Let's go. Come on.
One thing I do remember about sheep is they can be quite feisty, they can be quite grumpy, and they're very good at kicking.
Oh my God. These bloody
In Wales, Scott is trying to catch a ram so he can perform a vasectomy.
Oh my God. These bloody Hey, Scott. You got the wrong one there.
Hugh is a classic example of a Welsh farmer. Great sense of humour, great fun, very hospitable.
Not funny, Hugh. Not funny.
But more than happy to let the city boy go in and look like a fool.
Okay, come on, mate. Wait. He's not the best at handling sheep, I'm not saying, catching them, but he managed, just about. It was a bit funny, it was a bit entertaining.
I wouldn't want to go over there either if I was you. Come on. He really heard what we said we were going to do to him. You can tell he's not keen.
On a farm, we have to make do with what we've got. So using a hay bale as a surgical table is all we've got. And obviously it's not the most sterile environment, but we wash up and we scrub up and we clean things as best we can. Right, so if you feel the cord, Scott, you can feel the part we want to cut out, the vas deferens underneath there.
Yeah, so you got the spermatic cord, which is the blood supply, and also the tube that allows the sperm to come to the outside, and that's the one we want to cut.
That's the one we want to cut. But there's a whole lot of blood vessels coming down here, so we have to avoid the blood vessels. Otherwise...
Yeah, complications.
There we are.
See, it is quite a delicate operation, isn't it?
Yeah. Just in there.
Yeah, that's it. That's it. I think you've got it now. That's it. Yeah, that nice white fibrous cord. Bring that out, and then.
Okay. Should we close this boy up?
Right.
So name is Ram Scott now, then?
That's right. I think so.
You're going to name it Scott now?
Definitely.
Yeah.
Okay.
Scott, no chance of having any lambs.
Come on, buddy.
Up you get. Come on.
Good boy. There we go. Good boy.
Well done.
He'll soon recover, Scott.
Yeah.
Yeah.
All right?
Yeah.
You're quite asleep already, so
Yeah, we're pretty chilled.
A world away at the high-tech Royal Veterinary College, bladder surgery on incontinent bulldogs Pickle and Lily is about to begin. Their condition is rare, so they've been brought to the RVC, where Dr. Roseanne Jepson will perform specialised laser surgery.
Both Lily and Pickle have abnormalities in their urinary tract. So they have tubes that connect the wrong components together, essentially. And what we're going to do is we're going to use a laser to try and correct those changes. Laser is a really exciting form of surgery because it's minimally invasive, and this is one of the reasons it's attractive not only to owners but also to the pets themselves, because it means that their recovery time is much, much faster. Okay, I think we're ready to start.
Lily is first to undergo the procedure. Dr. Roseanne and her team are using a camera to explore Lily's urinary tract.
So the kidney that she does have is her right, which would fit with that being the opening to the right ureter.
So we're about to start lasering. So we're going to laser the abnormal band of tissue between where the tube from the kidney down to the bladder should be, and essentially open that out so that the urine comes down that tube into the bladder rather than opening out in the urethra where it is at the moment. Stop. Yeah.
Okay.
So we've been able to laser the little bit of excess tissue that was present. We did find one slightly unusual finding was that she had a very small blind-ended tunnel, which may have been the opening of the ureter from the kidney that doesn't exist. But so far, so good. Procedure has gone as we hoped it would.
Now it's Pickle's turn for the high-tech laser surgery.
In terms of the procedure, it is quite technical. Every dog is very different, and so the same would be true for Lily and Pickle, and that creates some of the challenges that we have with this procedure.
Although Pickle has both her kidneys, she shares the same genetic abnormality as her sister, which means her internal plumbing is faulty and she constantly leaks urine.
Okay.
So both Lily and Pickle's procedures have gone very well today. We'll have to see how well they recover, and the next sort of 24, 48 hours really will tell us whether they're going to be continent after this procedure or not.
In Wales, Scott's next job is going to be a challenge.
I've just had a call from Philip, one of the vets, who needs some help with some horse dentistry. Now, as a small animal vet, we do dental work on dogs and cats all the time, even rabbits occasionally. But my horse dentistry, it's really quite rusty. So I'm really glad that Philip, as an experienced vet, is going to be on hand to help.
Waiting for Scott and Philip are friends Sue and Cher, and elderly mare Folly.
See what sort of mood she's in today? Folly! Hello, baby. I've had Folly 28 years now. She was my first horse, my dream horse. Yeah, I love her to bits.
You're such a good girl, aren't you?
You're going to enjoy the dentist today. Her dental appointment, I believe, she doesn't mind too much. Good girl. She tends to be quite relaxed about it, and sometimes she actually looks like she's enjoying it.
Come on, then.
Oh.
Hey, Philip.
Hi, Scott, how you doing? I called Scott today to give a hand with these horses. I thought it'd be something totally different for him and something he could get involved in.
What's that there?
Also, it's just handy to have another strong person there to help hold the horses.
Nice to meet you. Hi, I'm Scott.
Nice to meet you.
Hello. Hi, you're Sue?
I'm Sue.
Hello.
I'm Cher.
Hi, Cher. And I've heard this gorgeous creature is Folly.
It is Folly.
Hello, beautiful. They say it's a bit rude to ask a lady her age, but just by the look of her, she looks like she is quite mature. Is that fair?
She is mature, like her owner. Yeah, she's, Folly's about 38, 39 now.
Are you? You look absolutely gorgeous. Folly is so beautiful. She's got the most gorgeous blue eyes, and she's one of the oldest horses I've ever met. And being that she's a little bit, pardon the pun, long in the tooth, she's getting some dental work today.
She is, yeah. She hasn't got any problems that I see at the moment, but I still make sure that everything's right in her mouth and she's comfortable.
Yeah. Horse dentistry is really important in domestic animals because domestic horses live a very long time. Normal horses in the wild live to maybe 20 or so. So the older you get, like with us, the worse your teeth get. So, Philip, this is Folly, the ripe old age of 38.
Wonderful, isn't it?
Yeah.
Really good how some horses just keep on going.
Yeah.
And she's looking really good for her age too.
She is. All right, so got to put this one on.
Yeah, if you just extend it.
In order to be able to examine a horse's mouth properly, we need to place a gag, which is a large metal contraption. It allows the mouth to be open wide so it can assess the teeth, we can assess the gums and the tongue as well. So what do you look for first in the examination, Philip?
Just check all the teeth, just like your own dentist would do with you. It just goes round the whole mouth.
So you're feeling for sort of sharp edges, are you?
Basically, yeah. It's important that we check anything in the mouth that might be causing the horses discomfort and stop them eating properly. And also, old horses to be in danger of losing teeth, so we need to keep on top of what's happening in their mouths. Oh, yeah. Oh, she's got what's happened there? Ah, she's got a broken tooth. And there it is.
Oh, my gosh.
Whoa.
Yeah.
That is huge. Whereabouts is that come out from?
It's halfway along on her off side.
Okay.
Yeah.
Halfway along?
Yeah, on the bottom.
My goodness. So it was a bit shocking seeing that drop out of her mouth.
You can see that root there has gone rotten. It's just come away.
It is quite confronting to see a tooth just come out of a horse's mouth like that. But for Folly, she's an old girl, and to lose a tooth at her age is quite normal. And the good thing about it coming out whilst we're here is that we're able to check for any underlying problems. I think that feels okay. It's not really impacting on any of the other teeth, and it's not infected. It's not seemingly causing her any discomfort.
Yeah, I'm happy with that.
The next stage of Folly's treatment is a procedure called floating.
Put a bit of downward pressure with this hand down on the handle.
Using a coarse file, Scott will shave down any sharp edges on Folly's teeth.
Yeah, you really have to give it a bit more force than you'd imagine. Good girl. Again, it's just about not taking up too much, isn't it?
Yeah, that's right. If you want to do the same then on the bottom.
Folly, you're being a very good girl.
She's very patient, isn't she? She's just so good. She's such a good girl.
Oh, okay, baby. There we go. I mean, have a feel, Philip. I think that feels okay.
I'm happy with that.
I think it went very well.
Yeah.
Folly was happy with Scott. She seemed quite relaxed with him.
Oh, yes, she did, yeah.
She did, didn't she?
Yeah.
Oh,
there you go, baby.
Okay, wonderful.
Good girl.
Thank you, guys. She's going to feel much more comfortable now.
Now we're done with Folly's dental procedure. She's got a perfect smile. I think it's only fair. She's been a good girl at the dentist. She deserves a treat. There you go. Hey, don't tell Mummy. Don't tell Mummy. Yeah.
Good hope.
It's a busy time for the farmers in the area, with everyone getting ready for the local agricultural show.
Go then.
For farmer Clive, it's an especially nervous day.
It's my lifetime's work breeding cattle, and it's my father's lifetime's work before me. And the best barometer of judging the quality of your herd is to take them out and compare them with other people that are trying to do the same thing.
But several years ago, Clive's farm was affected by the highly contagious bovine TB.
Bovine tuberculosis in this part of Wales has been a major issue. It's a serious problem because it's a disease that affects the lungs and lymph nodes, and there is a risk.
Although the farm is now free from the disease, Clive's herd still has to undergo regular testing.
Bring the other one in as well.
And head farm vet David has just arrived.
Okay.
Bovine TB is spread by infected badgers, and the ramifications for farmers like Clive are enormous.
Just the physical having to test the whole herd every 60 days is it's a nightmare.
7, okay, that's great.
You have to keep doing it until the government find a way of actually getting rid of it so that we have healthy cattle and healthy wildlife.
Ooh, it's a bit of a worry. I'll have to check, Clive. I'll have to check as well.
Fair enough.
If the tests return a positive result for TB, Clive's cows will be ineligible to be entered in the local show.
All right, 7. Let's check the bottom. 7, good.
Good.
That's great.
Happy days.
Yeah. It's such excellent news for Clive. And I'm also relieved because, as a vet, there's nothing worse than bringing the farmer bad news. So to be clear today, it's a big relief. She's fine, she's clear.
Great.
Good.
Sinclair Show, here we come. It's really good news. The cows are clear to go for Sinclair Show tomorrow. A bit of elbow grease using them tonight and a spit and polish and get them look as good as possible. So I'm very, very happy.
Do you reckon they're a bit better?
I am covered in your hair, Lily.
It's better than being covered in her urine.
In Teddington, 2-year-old sisters Lily and Pickle have recovered well from the laser surgery on their leaky bladders.
Both of them seem to be plumbed in a little bit weird. So basically the ureters weren't quite going where they should be, which meant what you were pouring in one end was pretty much coming out the other.
Ready? Coverage.
Sally was hopeful that after the high-tech laser procedure on both the girls, her days of endlessly cleaning up after them would be over.
Which body? Which body?
We were always told it would be a 50% success rate, and it was a 50% success rate. One of them's working, and the other one, unfortunately, seems to be a little bit better, but certainly not where we'd hoped. So we're very pleased with the fact that Lily's now totally dry. It's fantastic. And we're very hopeful that Pickle, with a bit of medication, will have a nice dry dog at the end of all of this. So fingers crossed.
Sally is staying positive.
It has made a difference. I only have to wash the sofa covers, twice a week instead of 4 times a week.
Scott's stint in Wales is almost over, but the locals have asked him to help out with something very dear to their hearts.
After a fantastic and exhausting and exhilarating week here in Wales, I'm here at the Sinclair's show. It's all the great farmers of the area coming together with their beautiful animals to show them in the ring.
The agricultural show is the highlight of the farming community's year.
The Sinclair's Agricultural Show is a family show, it's a community show. It's been running now since late 1800s. We seem to be going from strength to strength.
Morning, Clive.
Morning, Scott.
Scott is keen to meet dairy farmer Clive.
Say hello, ladies.
His cows have passed TB test, and now he's hoping for a win in the ring.
And what's the general sort of physical attributes that they're looking for in a winner?
In a winner, you want a nice, tall, fine-bodied animal.
We're talking about cows, right?
Cows,
okay.
Yes, we are talking about cows.
Just checking.
But you want a good-looking cow.
Yeah.
It's nice to have a good-looking woman on your arm as well.
Well, absolutely.
The cows will need some last-minute spit and polish, and Clive has roped in Scott to help.
All right. Don't let go.
Okay, I won't. What's her name?
Tunisia.
A very fancy name for a girl from Wales, isn't it? I'm feeling confident for Clive, and I really hope that after all the bad luck that he's had, he can have a win here.
Shampooing a cow, so...
It's not something I've done before. I just thought when a cow would come, they'd be cleaned first, but in fact, they don't travel well.
And I want her shining.
You want her shining?
Oh, I don't want to see any muck on her whatsoever.
Mizzy, you and I are going to have words. A bit like when you used to earn your pocket money and you have to wash your dad's car.
I'm not giving you pocket money.
I don't even get pocket money. Great. I've never actually had to shine up a cow before, but she seems to be enjoying it, and in fairness, she looks awesome. Hey, you ready to go? Ready to hit the ring? I'm really hoping today that I get to walk one of the cows into the ring. It'll be quite an honor to be able to do that, and I'm wondering what technique there is. I kind of remember the dog ladies at Crufts that sort of have that jaunty little run as they run in with a big smile on their face. So I'm hoping it's something similar, and I hope that I do Clive proud.
Are you all right there then, Scott? Back there?
Oh, yeah, never been better. Yeah,
right.
Yeah.
You know,
I hope no one's watching this.
Make sure it doesn't miss the bucket.
Yeah.
And I warn you, if she coughs...
Great.
Yeah, I'll be okay.
Good luck.
Tunisia's been entered in the cow with calf category, where judges will be looking for a wide body, strong legs, and big udders.
Oh! Clive's cow decided to have a sit down mid-walk, which was lazy at best, but she's still looking beautiful.
And she's caught the judge's eye, making it to the final 2 in her class.
There you go. All right. Thank you.
Ah, well done, Clive. Good job, mate.
Second prize for today. She's a cracking cow that beat me, and they both looked very well in the ring, so I was quite happy. Scott's a good help. He's marvellous, you know, I couldn't manage without him. He'll have to come every time I go showing.
Scott's now back on more familiar territory.
Wow, there are some very strong contenders.
The organisers have invited him to be the guest judge in the canine novelty section.
Everyone smile.
Everybody was booked in to have their hair done, ready for Scott at St. Clair's show.
Oh, you're so pretty. Your dad's done a great job of your coat. Look at that. You're a bit grumpy, but you've got very nice eyes. Wow, that must have taken some work, I would have thought. There's lots of things that I'm looking for as part of this competition, and it isn't just about doggy good looks. I'm looking for healthy body condition, a lovely, shiny, silky, well-groomed coat, beautiful white teeth, and even their age.
She's one of the oldest Leos being shown in the country.
I thought she was a Leonberger. She's gorgeous.
She's 9 in a couple of weeks.
Such nice dogs you've got in St. Clair's, haven't you?
How well the dogs perform in the ring is also important.
Very nice. Very pretty girl. Some stiff competition there.
Before Scott announces the winner, he needs to award the runner-up.
Reserve champion goes to our lovely old lady right here. Congratulations.
Thank you.
Congratulations. Well done. Well done. My pleasure. Beautiful.
And now it's decision time for the all-important Best in Show.
Well, firstly, can I say you're all winners, and they're all fantastic dogs, but the winner of the St. Clair's Agricultural Show 2017 is the Bernese. Congratulations. Well done. Good job. Well done. Good girl. Here we go. That's yours. That's yours. Should I put it on you or the dog? I'm going to put it on you. You can just say you're the champion of everything. There we go. Well done. Congratulations.
Thank you. Good girl. I do watch him on the telly. It's not every day you all cuddle with a celebrity, is it?
The 139th St. Clair's show has been a resounding success as Scott prepares to leave Wales for home.
Hey Scott, it's been great to have you and the team here again for a few days.
Thanks.
I think we've all enjoyed it.
Thank you. Well, I've really enjoyed myself, and hopefully I've impressed you with my farm skills a little bit, maybe?
Yeah, Scott, I think slowly we can see the farm vet emerging in you.
Boys, it's been a pleasure.
Our pleasure, really good.
Thanks for having us.
Great having you again.
Cheers.
Hope to see you again soon.
All the best. Bye.
Okay, David. Yeah,
Let's
go
go
for a
for a
beer.
drink. Yeah.
Come on.
I've absolutely loved my time here in Wales. The country people and their relationship with their animals is just so special. Today's been just a massive celebration of that fact, and I've been very honoured to be a part of it.
I'm just on a long drive up to North London to visit the All Dogs Matter charity. They are a fantastic organisation that rescue dogs that are stray here in the capital. And today they've given me a call about an old dog that has a problem list as long as your arm. So I'm just driving up there straight away to see if there's anything that I can do to help.
It's a baby, aren't you?
Animal rescuer Sonia is waiting with a 14-year-old English Bull Terrier called Arnie.
So we rescued Arnie from the local pound. Arnie's coming in a really bad condition, and he really needs Scott to have a good look at him and make him better again, make him the handsome boy that he was.
Hello, Sonia.
Hi, Scott, how are you?
Great to see you.
And you. This is Arnie.
Hello, boy.
Come on.
Oh, he's an English Bull Terrier. He is. He is. Oh, my goodness. You are so handsome, aren't you?
Boy.
You are so handsome.
Sonia wouldn't have known this, but I had a rescue English Bull Terrier when I was going through university. His name was Zed. We had a massive bromance. I absolutely adored him. So to see another one here that I can help today, I think it's really special.
He's got a nice shiny coat. He's a little bit thin, isn't he?
Bit underweight.
Bit underweight, yeah. And anything else?
He's got problems with his ears and his teeth as well.
His teeth, yeah. Are they bad? Can I have a look at this side, Arnie boy?
Good
Oh,
boy.
yeah, they're horrible.
Then we've also got his paws.
Oh, ouchie, Archie, look at that.
Yeah.
Straight away,
Some
that
of them
dew claw's grown there.
Growing.
And then, oh.
He's got this huge lump.
Oh, my goodness me. That didn't grow overnight,
No.
so someone has literally just left that
I
to
mean,
grow.
how long would you say that's been there for?
Oh, probably a good year, I would say. I mean, it depends on what it is. And that's the real worry, is it could be something benign, it could be something horrendously malignant. So we won't know until we take it off.
It really is sad to see a dog come in at that age. For us, it's shocking, really. I mean, it's disgusting that people can abandon a dog at any age, but when they really need you and they're in such a bad way, I've got no words, really.
Who abandons a dog? I mean, he's given you all that love and attention and joy, and then at the tail end of his life, when he's got a few issues, dump him. Just heartless.
Too sad.
It's always very upsetting to see any rescue animal and understand why they have just been turfed out of a loving home. Arnie particularly is pulling at my heartstrings. I absolutely love them as a breed. I know what they're like. I know how loving and loyal they are. And his owners have gone, you know what, we've had our best years with him. We're going to turf him out. And it just angers me to the very core.
I think I might take him with me, son.
Okay, I was hoping you'd say that. Scott's going to take him back to Richmond. Him and his team are going to do some wonderful work on Arnie. Bye, darling. He has got a lot of things wrong with him at the moment, but if anyone can make him better, paws crossed, Scott can do that.
Let's go to Richmond, hey? Let's show off a big muscly boy. Yes, yeah.
Orlando, tell me the truth. Did you just give Coco some food under the table, yes or no? It's obvious you did. You are guilty as charged, young man.
Unlike Arnie, Coco the pug is a very much loved family pet.
It's definitely got a sibling vibe, their relationship. They don't just treat her like a dog, they treat her like an equal. If they're not with her, they miss her. When they come back from school, the first thing they want to do is see her. They kind of fight over who gets to have her. It's a lovin', general lovin'. Good girl.
But the bond is closest between Coco and Anna herself.
Yes. Our relationship is very intense. It is a love affair. I mean, we spend all our time together. It was important that I had to get a girl because I am the only woman in this house with 3 sons and my husband. I mean, she is like one of my children. as far as I'm concerned. I mean, she's my fourth child.
You want to have a nap now, don't you, after all that eating?
She likes the good life. She likes human food. She will bark at the TV if she doesn't like the show. She'll bark at my feet if she wants me to pick her up. So yeah, we kind of slightly have to sort of pander to her needs, let's say.
Anna is dreading her trip to the vets tomorrow. She will have to hand over her special girl for her spay operation.
It is going to be scary, kind of leaving her. I don't think I've ever actually left her before.
Coco might be unaware of the impending surgery, but she's lapping up all the extra attention.
Massaged, pampered, stroked, nestled on me. There's nowhere that you'd rather be, is there, young lady? She is little, she is a baby, and yeah, it's going to be a bit nerve-wracking. Good girl.
Come on, this way. Good boy, come on. Here we go. Come on.
Scott has arrived back at the Richmond clinic with
Come
elderly
on.
rescue dog Arnie.
Come on. Good boy. In you come. Hi, guys.
Hi, Scott.
Can I introduce you to a very special boy?
Arnie is
This
getting
is
a
Arnie.
warm welcome from nurse Nathan and receptionist Kirsty.
He is a rescue dog. Unfortunately, his owners, after having him for 12 years, 13 years, have decided that they're just going to dump him. He's an old boy with quite a few problems. Come on in. Go with Uncle Nathan. Here he is. There he is. Come on in. All right. I've just put a call through to a really good friend of mine to help with Arnie's care, and she is very much a fellow Bull Terrier lover. Ali, well, she's always wanted to be a veterinary nurse, and I thought this was the perfect opportunity for her to have a spot of work experience with her favourite breed. What do you reckon she's gonna... She's gonna go sick for you. She is. She is. Ali, this is Arnie. Don't cry, you're gonna make me cry.
No, darling. When I walked down and saw him, it was a shock. It was memories. It was, yeah, mixed emotions, but he's such a sweetheart.
Ali's first dog was an English Bull Terrier called Ruck, and it was through him that she first met Scott. Ruck has since passed away, but Scott and Ali have been firm friends ever since.
He's beautiful, isn't he?
He's very gorgeous. It just brings all the memories flooding back. So you start thinking about your dog and all the history with Scott and just how sad I was to lose mine. I just wanted to meet the little fella and see if he was all right.
Go and put some scrubs on, my dear.
Excited.
Scott has another motive for calling Ali in today.
We need to talk about what
He's
we're going to
hoping
do
she
with this
might
boy.
even consider adopting the old dog once he's nursed back to good health.
What he needs is a mountain of love. This boy has been shortchanged and he needs love urgently. Ali has such empathy and such care for animals, and she really wants to make Arnie feel loved, which is possibly the first time in his life he's really felt it.
Ta-da!
Ah, look.
Oh,
Looks
now
more
I'm ready.
nasty already. Very good. Right.
I'm ready to look after the fella.
Yes. So he has quite the litany of problems, and we need to just prioritise as his veterinary carers what we're going to do. All right. So to start with, have a look at this.
Oh.
Absolutely horrific.
Oh my God, it makes me so mad.
Also, you can see his toenails are very long. Very sad to know that he's got ingrown ones as well. Then last but not least is this is the piece that I'm most concerned about. Very vascular, very large, very nodular, all things which could suggest that it's something not very nice.
And if it is nasty, is it likely to be elsewhere?
It could well be.
I volunteer with dog charities and it never stops making me sad how people can just abandon a dog. It's just a catalogue of neglect to me that people haven't taken their role as a dog owner and dog carer and, you know, dog mum seriously.
All right, but let's sort this immediate issue out. I mean, look at that. It's gone right around.
Back into the pad. That must be agony.
Yeah. It just shows how amazing dogs are, that he is in constant discomfort and yet can still find love in his heart for us, even though humans
we do that to him.
Exactly. God, they're so big and thick. Yeah, classic Bull Terrier nails. There you go, mate. That's what healthy, normal-looking nails looks like. Much better. No more digging in. So already we've made his life better.
Absolutely.
The nail clipping was straightforward, but now it's time for the far more complicated removal of the nasty lump on Arnie's bottom.
The lump under his tail probably worries me the most because in older dogs, there are some fairly nasty types of cancer that can develop around the anus. Some of them, like carcinomas, for example, are incredibly malignant and if present, will be fatal very quickly. If you can pull his legs a little bit further back, I really want to see that sort of come right up to me. That's it. Great.
Arnie's surgery is about to begin, and already Scott is worried about the elderly dog.
He is breathing a little bit roughly, so we are concerned about the anaesthetic, and we need to just make sure we keep a very close eye on him. All right, I'm cutting now. You ready to go? So what I'm going to have to do is cut through the skin. Once I start cutting into it, I can see it is just bleeding everywhere. But thankfully for Ali, she was tough enough and she didn't faint. Dog okay, Nath?
Yeah, it's fine.
Here we go. This is going to come off now, likely. All right. Come off. There we go. There we have it. Nasty looking thing. And unfortunately, it's so big and so thickened that I wouldn't be able to say that we've got good margins so that we have 100% cure. But we need to send this up to the lab and the pathologist will tell us what kind of cells make this up and are they bad ones or is it just an abnormal growth of an old boy? Let's hope
and
it's
the
the
latter. And if it's a bad one, what you're saying is you might not have got it all.
That's right, and I can't take any more away because I'll then affect the ability for his bum to work. He'll be incontinent, which is yet another reason why I won't get a home, so.
I meet lots of rescue dogs. I've met rescue Bull Terriers, not many, but I haven't been involved in surgery and he's so neglected, such a mess. Who's going to take him?
Come on. He's been a right soldier, hasn't he?
He has. Love him.
The next few days here at the practice is going to be an agonising wait because we need to wait for the pathologist's report on Arnie's lump.
There you go.
Hopefully, if that comes back okay and it's not a nasty type of cancer, then we still have to put the poor old boy through yet another anaesthetic to sort out his horrendous teeth. And then we've got to find him a new home. So there's lots of question marks still to come in Arnie's future.
I know, it's just me. It's just me. I know.
I'd like to think that Ali's thinking about taking Arnie.
Darling, I know.
He is definitely twanging her heartstrings. And I think that he'll be a very lucky boy if he gets to go home with Ali.
It's okay.
I think this is like his favourite thing, isn't it?
I know, just cuddles.
A day after surgery to remove a massive lump from his bottom, elderly rescue dog Arnie is recovering well.
It's a hard life, isn't it?
And nurse Reagan and receptionist Kirsty are making sure he's getting lots of love.
Having Arnie here has been amazing. We've all fallen in love with him. Any kind of bull breed, I absolutely love them. And he's just been quite a good addition to the practice.
The old dog's next round of surgery on his badly neglected teeth will be in a few days. Scott and his team are hopeful he will then be well enough to go to a new home.
Oh, good boy.
So Phoebe should be getting here pretty soon.
Yeah, how exciting for her. Cool.
A new vet is arriving at the practice today, and Scott and nurse Reagan are waiting to welcome her.
What's she like?
She's very nice.
Yeah?
Yeah, very wide-eyed, very keen.
Cool.
And sure to be very, very nervous. This is the first time I've ever employed a newly qualified vet. It's quite a big undertaking because they do need quite a lot of support. But at the same time, I met Phoebe last year. She came and saw practice here, and we really liked her. She got on well with my team, and that's really important to me, so I thought I'd give her a go. Ah, and here she is.
Hi.
Hey.
I'm Phoebe.
I'm Reagan. Nice to meet you.
Nice
How you doing?
to meet you.
Welcome.
Hello again.
How are you feeling?
Nervous.
Yeah.
But excited.
Good.
Yeah. It's nice to have Scott as a friendly face on your first day. I'm really glad that I did placements here, so at least I vaguely know my way around most of the staff and the buildings.
Well, we've got lots of exciting things lined up for you today.
But you're going to start me off easy, right? Vaccines, health checks.
We'll see. We'll see. You've done lots of learning. Now I
Yeah.
think you need to get your hands dirty.
Okay. Wish me luck. Good luck.
Should we go walkies? Come on, good girl. Where are we going?
And it's not long before
gonna go
Phoebe's
here?
first patient arrives for her appointment.
Hi, Kirsty.
Hi, how are you?
I'm all right. How are you?
Yeah, good. You got Coco.
I've got Coco.
No.
Phoebe might have been hoping for light duties first off, but she'll be starting with a surgery.
My pug Coco's being spayed. I know it's kind of a normal operation, but it's a bit stressful because it's my baby.
Yay. Yay. Oh, yes. Hi, Anna. I'm Phoebe.
Hi, Phoebe.
Nice to meet you.
Nice to meet you too.
And this is Coco.
Yes, this is Coco.
Hello. Right, let's come through.
It might be only her first day on the job, but graduate vet Phoebe is quick to recognise canine blue blood.
Oh, she really is a little princess, isn't she?
Yes, you are. Well, apparently in China, they were only owned by the Chinese aristocracy and kings and queens, and they actually had their own servants.
So does Coco have servants?
I'm an unofficial servant. I do everything for you, don't I? Totally in your power, young lady.
Yes, I am. Yes. So what's Coco in for today?
Her spaying.
Her spay.
Spaying.
Are you nervous?
A bit, yeah. Just because it's an operation.
You have no problems with her health-wise?
No, she's fine. She's really healthy, loves walking, eats well. Actually, she did have a hernia.
A hernia?
She was little, quite a big one.
Okay.
We were told to monitor it, and it's kind of now disappeared. But I know that if you find it, you might be able to take it out in the spay.
Yeah, it's not there at the moment.
No, it's just completely disappeared.
But that is the thing with hernias, is that they can pop in and out. So definitely we can look at it while she's under, and if there is a hole, then we can close that up.
Okay.
She's going to be absolutely fine.
You'll be fine, young lady, won't you? Yeah? Good girl.
Anna dotes on Coco, and she was very worried about the surgery. So I hope we set some of her fears at rest.
Right, I'm going to leave you now, Coco.
Bye. We'll take good care of her.
Bye. Good girl. Go on.
You'll be back with your servants soon.
Yes, your servant and your mother and everything.
Bye, lovely. Bye.
It's going to be a stressful day. Until I get the call that she's okay, I'm going to be a bit on tenterhooks, I think.
Are they talking to each other? Yeah. They do talk to each other, don't they?
Scott's next two patients are in Hampton Hill. They're a pair of elderly tortoises that recently came to live with Simone and her young family.
They seem very hungry today, don't they?
A friend posted on Facebook that his parents were retired and that they were looking to rehome their tortoises, and would anybody be interested in having them? And I jumped at it. Yes, yes, please, please. We have a boy and a girl, Molly and Atwin. We haven't had them that long, and I absolutely adore them. And they've become a very, very big part of our life, like all of our lives, the kids as well.
Is he gonna like Apple?
The pair will be Scott's oldest ever patients. They're estimated to be over 100 years old.
We assume that they would have been brought over from Africa in between the world wars, the First World War and the Second World War, and they would have survived the Second World War in England somewhere, which is incredible. I was so excited to get them, and then suddenly was all scared about, but I have to look after them really carefully. People before me looked after them so well, and to have brought them to this stage, I feel I can't sort of drop the baton now.
But recently, Simone has noticed male tortoise Atwin has a problem. So she's called Scott to check him out.
Hi, Simone. How are you?
Scott.
I can't wait to see my reptile patients.
Yeah, come in and meet them.
There's one of the patients.
There he is.
He's walking quite quickly for an old timer.
They move quicker than you would expect. So,
Hello.
so this is Aswin. So this is the boy.
It's absolutely incredible, isn't it, to think that you're holding a 100-year-old animal.
I know. It's quite a responsibility.
Isn't it? It's great being a vet when you can go out and about and meet other animals, but particularly ones so old. A full 100 years, it does make them incredibly precious creatures. So I can see that discharge. How long has that been there for?
Probably about 2 or 3 weeks.
Okay. And do you think it's affecting him at all? I mean, is he coughing or sneezing or...?
Not that I've noticed.
No.
And he's eating lots, and
Eating
as you've
well.
seen, he's active.
Yeah. Okay. Having a general look at Atwin, he seems like a very healthy tortoise. But runny nose in a tortoise, generally it's not just a simple cold like in people. In a tortoise, if left alone, it can become something more complicated, something like pneumonia. I think what's happened in this case, he's a new animal to you.
Yeah.
And I think during the process of movement from
Yeah.
the old to the new,
Yeah.
he's an old boy and they don't cope with change very well.
Yeah.
So I think he's probably got a little bit stressed and as a result has
Okay.
developed this condition.
Yeah. Oh, good boy.
There you go. After putting a couple of antibiotic drops into Atwin's nostrils, he looks wholeheartedly unimpressed, but as a 100-year-old, he's allowed to be a bit grumpy, but he seems very happy and I'm sure he's going to make a full recovery. Good boy.
Give him a rest.
Yeah. All right, then.
Come
Go
on
and
then,
pop in his
buddy.
bed.
Let me take you to bed. I'm very relieved that we got Scott around. Part of me initially was, oh, it's just a bit of a runny nose. I don't want to waste his time. But I'm very glad that we did call him in.
So you've got another tortoise somewhere around here, haven't you?
She's just over there in the corner. Shall I go and get her for you?
Yeah.
Atwin's partner is a female called Molly.
So she's a lot heavier.
And is she equal in age as well?
Yeah, they've been together for about 80 years that we know of.
And do the old couple get on very well?
Yes, he can bother her at times. And
Bother? What do you mean?
How do I put it tactfully?
I don't know. What are you going to say?
So Atwin does harass Molly quite a lot, and their mating ritual is essentially to headbutt and bite. Occasionally, if he is being a bit rambunctious, I will bring him in the house or put him in a pen or just take him to the other side of the garden. But she doesn't actually seem that bothered.
I've gone for flowers before, but maybe I'll try headbutting.
Headbutting.
Yeah.
I've caught him on top of her a couple of times when we first had them, and then she laid some eggs.
Wow. Wow, you've got tortoise eggs.
We have tortoise eggs.
Oh my goodness. You can't help but be really impressed that two old-timers are busily getting at it in Simone's garden. So whatever she's got growing here, it obviously works very well in that department.
So they're in here. We have 2 trays. That one has 3 in it.
Wow, that's amazing. Look at that. You can actually see that there is some density in there. So it could be a yolk
Okay.
and a white, just like a normal chicken egg.
Yeah.
But that doesn't mean that it's naturally fertilized. But we know that
Yeah.
these guys have been
Busy.
getting on the good foot and doing the bad thing. And as a result, there could be some tortoise babies in there. You never know. Well, they're doing well in this incubator. They're nice and warm. So let's get them back in there.
Lovely.
Good luck, little ones.
All fingers crossed. Hope that we possibly get some baby tortoises out of it.
You've totally got to invite me back when you get the pitter-patter of tiny little tortoise feet.
Definitely. Well, definitely. Slightly panic call, no doubt.
Yeah.
Oh, what do I do now?
And I'll check on Atwin's snotty nose at the same
Yes. No, that'd be lovely. Thank you. Well,
No
thank
problem.
you for coming out.
Pleasure.
Thank you.
It's obvious to see that Simone is really dedicated to these tortoises already. She has real love for them. I think she has real respect for them and she wants to do the best by them. So she's the perfect new owner for them and hopefully they'll live a further long and happy life with her.
Hi, Jess. Hi, Phoebe. This is Coco. Hi, Coco. You all right? What's Coco here for? Coco's in for her spay today. Oh, you're so cute. You're so tiny.
At the Richmond practice, Coco the pug is about to be spayed by graduate vet Phoebe, assisted by nurse Jess.
I'm a bit nervous because I haven't done that many spays. I did a few as a student, but since graduating, I've only assisted on one, and this will be the first one, being the main vet making all the decisions. Look at that. Well done, puppy. Well done.
Coco also has a small hernia which Phoebe will be repairing.
Hello, ladies.
And Scott has returned to the clinic to supervise both procedures.
Today I'm here just to lend a hand, to be a shoulder really for Phoebe as she embarks on this big journey of doing her first spay. It can be incredibly nerve-wracking, so I want to try and support her, to look after her and make sure she gets safely through this procedure, and so does Coco. How was Anna this morning? Was she fretting?
I told her she didn't need to be worried and that we'd take good care of her.
Yeah. Did you tell her how many spays you performed before you said that?
No, I kept that fact to myself, actually.
Well, that's okay. I've done quite a few, so don't you worry.
I know the theory of it and I've learnt it 1,000 times, but it's just those tiny little things in practice that are just a bit different, like a bit extra fat obscuring the uterus, a bleeder where I wasn't expecting one, that means you need to be able to react quickly, and that's what I need to hone down my skills.
Go for it.
Jess, are you happy? Happy, yeah. Okay.
Every single vet coming out of vet school is incredibly nervous when it comes to their first spay. It makes your heart go. It really does give you palpitations. It's a very nerve-wracking experience, but it's a real rite of passage as far as being a new graduate vet. Okay, so you've got your ovary at the end.
There's my ovary.
Okay. Now, the hardest bit for a new vet is to get used to how much tension you have to apply to break the ovarian ligament. And it's just about trying to feel confident with how much tension to apply to actually snap it. And it's always going to feel like more than you should. Can you feel the tension running up?
Yep, I can feel it stretching now.
Yep. And then you've got to just push down, snap.
Is she okay? Yeah. This is the most painful part of the procedure, isn't it?
For you or for the dog?
Both of us. It's stretching, it hasn't broken yet.
If you grab it, slightly twist your hand to the side, and then you can snap that way. Put that pressure downward. Really go for it. Breaking?
Yeah, broken.
That's great. Good job. I've seen vets struggle with that for years. So that's really good.
It's a bit nerve-wracking, but Scott was able to give me loads of helpful tips in spaying, and all of those are hopefully going to help me do my next spay quicker and easier.
So if you just start your second incision by just attaching it, yeah. Just going over the hernia, lovely. Not only is Coco in for her spay today, but also she has an umbilical hernia. Basically what we see in humans as an outie belly button. And that's just where the umbilical cord has detached from mum and the placenta. The abdominal wall hasn't closed properly. It leaves a hole and then a little bit of fat, and sometimes intestines can pop out. Phoebe's able to close up the skin really well, so no more hole and no more outie belly button. Done. Well done.
Thank you. Start to finish.
Very good.
Although I was very grateful for your assistance, Scott.
Very welcome. All right, now let's wake this princess up, shall we? Have we got her throne ready? Phoebe's done very well. I mean, this is a very nerve-wracking procedure for any new vet to do. She's jumped the hurdle and she's on her way. Well done. Oh, big stretch.
There we go. The surgery went really well. Coco's recovering. She doesn't have a hernia anymore. She doesn't have ovaries. I think we've done well.
Call your mummy.
In Richmond, it's time for Arnie's second surgery, this time to fix his badly neglected teeth.
Oh, look, who's that? Who is it? Who's that? Hi again. Careful.
Scott's invited Ali back to assist with today's surgery.
He's definitely happier. The wound at the back of his tail here, where we've removed the lump, is healing very nicely indeed. So nice assisting the other day. And even better news is the results have come back. And although it looked like an incredibly nasty tumour, it had the suggestion that it was going to become something nasty, but actually it's benign. So.
No way. Oh, mate. Just a nasty, horrible lump.
Yeah. Oh. More unsightly than dreadful. Yeah.
That's the best news.
Yeah. A little bit of sunshine in our boy's life.
But Arnie's good news is tinged with sadness
You'll be
after
sad to hear
Scott
that he's
found out
also
the poor old dog
established
is deaf.
Stone deaf.
Stone deaf.
Yeah, he can't hear a thing. Nothing. Hey?
Scott and his team are now more
he's
determined
doing so
than
well, and he's
ever to
settled
give
in
the brave Bull
immediately.
Terrier a better life.
Yeah, relaxed.
So now it's time to start his much-needed dental surgery.
Let's get you downstairs, my boy, and let's sort those teeth out. Although I'd love to give Arnie a Hollywood smile, this isn't a choice. I have to do this dental. His teeth are horrendous. There's a huge amount of bacteria and infection built up along his gum line, which will be having a major effect on not only his quality of life, but also the health of his liver and his kidneys. Hold your dental chart there, please,
Do
nurse.
I not need any gloves?
Well, we might get you pop on some gloves in a second.
Okay. Shall I fill his name in?
Yes, go for it. As Ali's here and she's a hard worker, I'm going to put her to work. So not only will she be my dental nurse for the day and help me to understand which teeth are going to stay and which teeth are going to go, but also she'll do a little spot of scaling and polishing. This is years worth of tartar that we're going to get rid of in an afternoon, which is quite satisfying, yeah.
God, you can be quite rough.
Yep. Doing a dental on a dog like Arnie is pretty dirty business. It's very grubby, it's quite bloody, and at times it's really quite rough as well. We have to put quite a bit of force in to remove some of the teeth that are loose and then scale all the nasty tartar that's been building up over a number of years. So 401 is loose, so that's going to come away.
8 of Arnie's teeth are badly infected and will have to be removed.
So when they come out that easily, they're meant to come out.
His gums are also in shocking condition.
Do you want the goggles?
And a thorough clean is needed to remove years of built-up tartar and plaque that's contributing to his gum disease.
It really must have been such a painful time. Every time he opened his mouth to chew, it must have been an exercise in discomfort. But now all that tartar's removed, just like when you go to a dental hygienist yourself, your teeth are all shiny and fresh. And that's exactly how hopefully Arnie will be feeling. Oh boy, well that's the last thing we need to do. Hopefully you can have a lovely retirement now. Ready for a loving home. Do you know anyone? I'm trying to be very subtle when it comes to Ali and maybe considering that she should take Arnie home with her. I'm not normally classed as subtle. My wife would say I'm like a brick through a window.
But Scott's not so gentle persuasion seems to be working.
He's a lovely boy.
He is, and when he's up, he's such a joy. Tail going.
It's a classic love sponge. You. Hey.
You could share him.
Maybe we dog share.
Yeah.
You have to tell Zoe.
Hello, Coco. Time to go and see Mummy. There we go. Should we go see Mummy?
In Richmond, Anna and her 3 boys are anxious to see how their precious pug Coco has fared after her operation.
Here she is.
Hello, darling. Oh,
Little baby. She's been really, really good.
Okay.
The surgery went really well. We managed to spay her and repair the hernia. She's recovered well and she's had some food.
Good girl, you're such a brave girl.
Anna's definitely delighted to have her little girl back in her arms. I think with all the crazy boys around, she needs a bit of sanity and a bit of girl power.
Yeah.
She's going to need some big brotherly love,
Yeah.
okay?
Thank you.
Thank you very much,
That's okay,
Phoebe.
boys. I'm just glad she's all right.
Yeah, no, honestly, thank you so much.
No problem.
The princess is home and she's going to be treated like a princess for the next few days for sure. So yeah, that'll be easy for me to do. Movies, cuddles on the sofa, just chilling out with Coco and the boys, and she is going to be in charge. Girl.
Good boy. That's it. What a good old gent. Okay, now remember, best behaviour. Hey, mind your P's and Q's.
Today, Scott has brought rescue dog Arnie to a local park.
Walking down the hill with Arnie, immediately I get a little bit nervous. There's real trepidation because this is a make or break moment. Arnie has the chance of a new life with someone absolutely amazing. So I just hope this works, but I am very, very nervous.
Uncle Scott's on his way with a surprise.
Scott is hoping his good friend Ali will give Arnie a new home. But it all hinges on how well Ali's dog Mabel gets on with the old Bull Terrier.
I can see your potential new family over here. Come on.
My biggest priority is Mabel. I hope the meet and greet goes really well, but I need to be sure that I'm doing the right thing for her before I can do the right thing for him.
Hey, Al.
Hey there.
Who's that? Who's this handsome guy?
Look at him.
Who's this handsome guy?
Jenny.
Say hi.
Oh, look at him. There you go.
Aww. Oh, they're going to do a dance.
We're going to do the lead dance.
Arnie and Mabel lock eyes and love at first sight. Oh, look. I think that's the first time I've seen him do that.
Oh.
Yeah.
Are you kidding?
No.
Oh, look. Mabel and Arnie seem to get along brilliantly.
Look at that.
Look at that.
Oh. Immediately, Arnie starts to play bow, which is a exhibition of happiness where they want to engage another dog in play behaviour. That's so, so positive. They start walking around and smelling each other, which is very normal for dogs. And then they get to a point where they're so comfortable in each other's company that they pretty much ignore each other. That is an ideal result.
That's brilliant, isn't it?
Very calm, very relaxed.
Yeah, I'm really happy with that.
Very happy, waggy tails. We really couldn't ask for anything better.
No.
The look in Ali's face shows how calm and how happy she is about the situation. Looking good.
He needs a good home. He hasn't had one, has he? And I think I can give him a pretty good home.
Yeah.
It feels kind of right.
So happy. So happy. So nice. It might not be for a long time, but it'll be for a good time.
You'll be fed well and loved, sweets.
Yeah. And I'll be there, and you've got a personal physician.
That's it. The meet and greet went brilliantly. So, yeah, I'm really, really happy. I think he's found a home with me.
You're right there, Mabel. Hey? You're right there. Hey?
You're missing out, darling. Did you just
You're right.
breathe?
Right there. As Arnie's an old boy, he still needs a little bit more treatment before he's fully ready to go to his new forever home. So he's going to come back to the practice with me, but very soon I get to help this boy as he ventures forth into this wonderful retirement. Happy families.
I hope so.
Right, let's come and find Atwin.
Yes, the obligatory search for the tortoise.
Scott's back at Simone's house to check up on one of his oldest patients, a
getting
100-year-old
on?
tortoise with a runny nose.
He's doing a lot better.
Good. Well, his nostrils look nice and clear, don't they, champ? And no discharge, which is brilliant. Good stuff, my boy, hey? Or sir, as I should say, considering how old you are. I'm really glad to see that Atwin is back to full health and looking great. But I'm very curious about the fact that this old boy managed to procreate with his girlfriend and produce eggs. So what happened to them? I'm really interested to know.
Right, come through and I'd like you to meet Maisie and Daisy.
Wow.
These are our little tortoise babies.
Can I pick one of them up?
Yeah, feel free.
Hello, cutie. So which one's this one?
So that one is Maisie and this is Daisy.
Mm.
They're a week old today.
Yeah.
And we had the pleasure of watching them hatch out, which
Wow,
was
really?
amazing. When they were hatching, first of all, it was just a tiny little nose and a little face poking out. Slowly, one came out on its side, but the other one properly came out like a little dinosaur with its front paws first. And it was incredibly cute to watch.
You can do this, little fella.
I mean, they're absolutely fantastic. And to think that they've come from 100-year-old parents.
I know.
It's incredible.
I really didn't think the eggs would hatch. I thought that was a real long shot.
These little creatures are so amazing and extraordinary, and I feel very honoured that I've been allowed to examine them for the very first time. But at some point in their life, they'll be examined by a vet that isn't even born yet, which is a bit frightening, but super cool at the same time.
And if we do everything right, there's no reason why my grandkids or even my great-grandkids might not be looking after these guys.
You guys have got a lovely future ahead.
We absolutely adore Maisie and Daisy. They've really become part of our family. A lot of friends have said, oh, are you going to rehome them and can we have one? It's like, no, they're ours to keep.
Graduate vet Phoebe is in Chiswick to check up on very special patient Coco and her doting owner, Anna.
Hi, Anna.
Hi, Phoebe. How are you?
I'm good. How are you?
I'm good. This young lady's very well as well.
Hello, Coco. I'm really excited to see Coco today. It's been a couple of weeks since she came in for her spay and her hernia repair. It was one of the first procedures I did since qualifying, so I'll be interested to see how the spay wound is healing. Right, should we have a little look at that scar then? Oh, wow, look at that. That looks really, really good. Got no recurrence of that hernia. It's nice and flat with the skin.
Yeah.
Yeah, there's no pain, swelling, discharge.
Oh.
No, that's really good. It's completely healed.
Amazing.
Well done, Coco.
Having Phoebe come to see us is really important, obviously, because Coco is our fourth child, basically, our only daughter, even though she's canine. And it's just really important to know that she's okay and that nothing's wrong and that she's recovered.
You're all done. You can be signed off now.
Good.
Go back to playing how you want to.
Yes.
It was really great to see Anna again and see Coco. I'm really, really happy with her wound. It's all healed really nicely.
Go!
She can now go back to normal exercise, playing with her brothers and being full-time princess.
Go, go, go! Come on! Good girl.
Phoebe made me feel, really happy about Coco's recovery. And I now know that I can take Coco out for a walk and, that she's happy and well. It means a lot to us.
Coco, Coco, Coco! Come on! Come on!
Good girl.
I will miss you. It's so lovely.
It's a milestone day for elderly dog Arnie. The 14-year-old rescue dog has undergone weeks of surgeries, medication and TLC. And today he's finally well enough to head off to his new home.
Hey guys, I was wondering where he was.
We just kidnapped him.
He's
Scott.
enjoying his favourite pastime of being adored.
Yeah, just making the most of it. It's last few minutes here.
Yeah. Obviously, it's very sad for us to say goodbye to Arnie because we've all absolutely fallen in love with him, particularly some of the support staff, Kirsty and Reagan. They adore him. They've actually taken him on weekends to their own homes and given him all the love and the care and attention that we all pride ourselves on. So it is very sad that they have to say goodbye to him, but for Arnie, it's a great day because he gets to go to a loving new home. Come on.
Come on, then.
Come on, mate. Let's go to your new home. Come on, buddy. Good boy. Good boy. That's it. Come on. There you go. Let's go. Let's go.
Sad. What are you going to do now?
I know.
Come on, then. Hey, chauffeur driven to your new home. Come on. Arnie's been with us for a long time now. For him to go to his new home, obviously, is a really important step in his future. But for us, we're left with a big hole. He has been such a wonderful personality to have in the building, and we're going to miss him very much. Okay, mate, let's go. Boys on tour. Yeah?
Big brother's coming today. Yes, he is.
At Arnie's new home in Surrey, an excited Ali is waiting with her other rescue dog, Mabel.
Mabel doesn't have a clue what's coming. But I think when he arrives, she'll think he's going to stay for a bit and then leave. It's just the bond between the two dogs. You're never really sure until, you're in the home environment. There's a tiny little bit of anxiety there. The rest of it is just excitement.
Okay. Come on then, handsome. We're here. There we go. Good boy. Come on then. Come on then. Come on, this is your new home. Hello, mate.
Hello, mate.
Hello, look.
Hello,
your new
fella.
friend. Look.
I know you can't hear me, but hello, fella.
Hello,
Here's your new boy.
Hello, fella. God, Scott is looking so well.
I know.
You've put on a few, well, I don't know how many kilos.
He's put on 4 kilograms.
4.
He's put on 1 kilogram a week. So he's just doing so well. And now you get to
Cheers.
enjoy the high life with Ali.
Welcome home, treasure. Hey.
It's an incredible full journey that we've had with Arnie. He's gone from rescue, we've rehabilitated him, had 2 major operations, and now he's going to be released back into the wilds of beautiful Surrey with Ali. He's going to have such a wonderful twilight of his life, and the fact that I've been able to play a part in that is really special for me. Go on, old man. Go on, you can do it.
So he's home. He's home here with us, with Mabel. He seems pretty relaxed. Mabel seems pretty relaxed. That's it. What a perfect day one.
So nice to just see him in a garden alley.
Oh, love him.
I know. He's so lovable. He's so lovable.